The senator from New Hampshire.
Thank you, Mr. President. I rise today to join my colleagues in expressing my opposition to Judge Kavanaugh's nomination. I will speak later in the evening about my overall assessment of Judge Kavanaugh's record and nomination, and about why I think some of my colleagues on the other side of the aisle are focusing on the wrong thing in deciding to support him. To echo my colleague from Michigan just now, no one has a right to a seat on the United States Supreme Court. What we should be focused on is that the country has a right to an impartial, nonpartisan United States Supreme Court. They have a right to justices whose character and fitness for the office is beyond reproach and beyond doubt. And despite everything I have heard from Judge Kavanaugh's supporters, I do not think they can make that case. Now, my purpose in speaking right now is to express my deep concerns with Judge Kavanaugh's record of ruling against access to health care. Mr. President, if confirmed, Judge Kavanaugh will be a deciding factor in the lives and livelihoods of millions of Americans. Yet time and again, he has demonstrated a commitment to a partisan agenda that would strip away care from some of our most vulnerable people. As recently as 2017, Judge Kavanaugh criticized Chief Justice Roberts' decision upholding the Affordable Care Act. And in his confirmation hearing, Judge Kavanaugh would not commit to upholding legal protections for people with pre-existing conditions such as asthma, cancer, diabetes, and more. Confirming Judge Kavanaugh to the Supreme Court would put those protections at risk. And I have heard from people across New Hampshire who are concerned about what will happen to them if they are denied coverage because of their pre-existing condition. People like Kristen from Derry, New Hampshire. Kristen relies on medications that cost more than $1,200 every month to stay healthy. But if she lost her insurance because of her pre-existing condition, she would not be able to afford that medication. Kristen said, and this is a quote, "I wouldn't be able to breathe correctly. My COPD would worsen. My current standard of living, working full-time as a social worker, a runner, active with my children, would quickly come to an end." Mr. President, that is what is at stake with this vote. Republican attorneys general, backed by the Trump administration, are suing to eliminate protections for pre-existing conditions. This case will soon be in front of the Supreme Court, and the next Supreme Court justice could very well be the deciding vote in that decision. We need a justice who would rise above partisanship, someone who will act impartially and rule on behalf of what is right for the American people. It is evident that Judge Kavanaugh is not that person. And there is no reason to believe that he would be an impartial arbiter when it comes to issues related to health care. Throughout this confirmation process, Judge Kavanaugh has revealed himself to be staunchly partisan. And never was that more clear than during his hearing on the allegations raised by Dr. Christine Blasey Ford. During that hearing, he called those credible allegations against him, and this is a quote, "revenge on behalf of the Clintons," and seemed to threaten his political enemies by saying, quote, "what goes around comes around." There is ample reason to to believe that Judge Kavanaugh would be an ally on the Supreme Court for the Trump administration and Republicans in Congress who are seeking to undermine our health care system, and for the health and well-being of Granite Staters and all Americans. I cannot support his nomination. Thank you, Mr. President. I yield the floor.